is funded by the Embassy of Denmark in Kenya. We are in 13 counties. So we are actually in the counties in Kenya where there is most need. These are counties that people refer to either as ASAL, arid and semi-arid lands. We know they are the hardest to reach among all the other counties. When you look at the ESCAP for family planning, for instance, it's where the coverage for family planning and contraception is lowest. If you're looking at indicators regarding GBS, gender-based violence, this is where the numbers are highest, but they are also not reported. And if you're looking at maternal mortality, this is where the numbers are also highest, but the interventions lack the synchrony and the synergy. So we're really honored because the embassy, ever heard of that word custom made, custom fit? The Accelerate project is custom made to meet the demands in these counties. And for that, we really thank the embassy and the partners that we work with.
Looking at the ASAL counties, they all have same characteristics. Among them, low literacy levels, child pregnancy, among others. On the background, as seen, 10 out of 13 counties under an Accelerate program have low literacy levels, ranging from 61% to 74%, according to KABS 2022. Without basic literacy skills, many girls and women face challenges in the following: understanding health information, accessing services, making informed decisions about their health, which has really contributed to unmet need for family planning, preventable maternal deaths, and increased vulnerability to gender-based violence. Accelerate program through CBOs works with Department of Adult Literacy and Learning to improve access to health, education for marginalized and hard-to-reach groups, targeting adolescent girls and women. The model leverages on the learning centers that provide a safe space for learning and sharing information. This is because now they have centers that you can move, and every time you are there, you can be able to reach them. So we have now that platform to do a follow-up to know the essence or the impact the RHNK program is impacting these women. The model leverages on learning centers that provide safe spaces for learning and sharing experience, provides an opportunity to follow up and continuous engagement to promote behavioral change. I believe probably next conference like this could be done in Kajiado, so that you can come experience the real experience at hand. Experience and learning, integrating health education into the other literacy classes is an effective and engaging women and girls on RHNK, maternal health, and GBV. The classes are in remote and hard-to-reach areas with poor road networks and rough terrains. I believe those guys like me are coming from these hard-to-reach areas, the ASAL counties, that is Mandera, Marsabit, Garissa, Samburu, name them. They face the same terrain that we do, making it hard even to access these women unless you're such passionate as the one man is doing in Kajiado County. Flexible hours centered around the timings that the best work for the girls and women. The kind of reception you get from these women, you can't even remember the train you went through. So it's at times so encouraging and challenging as well. Impact and social scalability to other counties. This has been notable shift and improvement in women and girls seeking timely maternal health services, awareness of family planning, maternal and newborn health issues, and GBV harmful practices. Improved agency among women and girls. Out of this, we have noted a great impact. They can now access their family planning, where again they are engaging their men. Men could not want to hear anything to do with family planning, and nowadays now through the male engagement forums, we have now been able to share the same. And of course, we still have a very long way to go, but somehow the impact is so felt.
So today we're going to look at access to justice. And before we even start the first slide, we want to understand, I'll start and end the presentation in the same way, and it's to understand why access to justice, why is it important. And I want to give you a scenario. So for example, you're a parent and your daughter goes through sexual violence. And this happens. We've seen so many of these cases. So we are trying to just bring it to light. So if this happens, you go get medical services, and then you have to go back home. As a mother, as a father, how peaceful are you knowing that the perpetrator is still out there and my daughter will still have to go to school, go to the shop, play with the kids? There is a need for legal action to be taken. And that's what we are going to look at. So for the very first thing, we are going to look at what we are doing and the statistics. So what we are looking at is what has been, and I tried to bring a picture on the last 2 years. I'll jump to first the second point, which says arise from 19 legal aid clinics. So between 2024 and 2025, the GBRC, supported by the Accelerate program, of course, through the Embassy of Denmark, it was able to have 19 legal aid clinics, which was a very good start, because this was what we were trying to do, what we were trying to build. And now when you look at the third point, which says 575 survivors access legal case management information, now this is in the next year. So we're jumping from 19 discussions on legal aid to 575 people having gotten this information. So it's a very big boost, and it's all coming from the support we're getting from our partners as well as our program officers on the ground. It's a very grim picture that a majority of the people who are getting treatment for gender-based violence, mostly sexual gender-based violence, are our young children and adolescents. So with that in mind, as the last point says, there's a need for protecting children, because we don't want to just help them once it has happened. We also want to make sure that we are a bit proactive and we ensure that these statistics do not speak on the big gap, but speak on the support for the very few who are still experiencing gender-based violence. So aside from the background, aside from the what, we want to look at how have we continued to support. And by access to justice, what we mean is how effective are we in making sure that any survivor who's gone through GBV can get the legal assistance to be able to take this case to the necessary legal pathways. So the very first thing is the clinics have expanded significantly this year. When you talk about expansion, we are not just talking about the reach, we're also talking about the people who we are engaging with. As the second point says, the CHPs we are managing to engage. These are the community health promoters that we manage to engage so that we can now use the people on the ground. Myself, I'm based in Nairobi. I would not know what happens where our previous presenter came from, yeah? So we're able to work now with the people on the ground to get to these cases, inform them on how best to report, inform them on how best to assist. That way, even a young girl who is 100 kilometers from the nearest center can still get legal representation, legal services, and the information they need to protect themselves and to also report cases of gender-based violence to court. We are also looking at inclusive pathways for male survivors. One of the things we come to realize when you're working with gender-based violence victims is most male survivors won't actually come and say this happened. There's a lot of stigma around it, stigma between men, also stigma between our communities, our social norms. So what we're trying to do is be more inclusive, show men they can also report, we can also pursue justice, and even as we are going to court, and this is being mentioned over and over again, based on the sessions that you're receiving, it becomes easier for the male survivors to report and get assistance. We're expanding the number of people who get to know about access to justice when it comes to GBV survivors. Yeah. So I cannot do my presentation without mentioning the strategic partnerships that have managed to help us get to where we are. So we have a lot of support, and all of it is coming from the strategic collaborations we have. Number one, integrated legal aid clinics, eliminate isolated efforts. So many different organizations are working on the same things. But the moment we try and work in our own angle, in our own corner, then we're not really helping the community. So by integrating our legal aid clinics, meaning if we are going to come to a community, then we need to work with whoever is there. We need also to work with the local administration, just making sure that we target the exact problem. And that's the importance of these strategic partnerships. We have a lot of partnerships with the local health facilities, the local administration, and also with the support of PS Kenya. Accelerate has managed to reach and support the 13 counties that we are currently active in. The second one is active collaboration with judicial structures. We have our program officers who work day in, day out, trying to pull in now the judicial sector, so that when it comes to implementation, which policies are not working the way they're supposed to, which laws are not benefiting these GBV survivors. For example, I believe for the cases that are currently in court, you find that some GBV cases take too long. So we have to go back to the CUC's, the Court Users Committee, and the IAWJ is the International Association for Women Judges. We are trying to understand how can we improve these laws to make sure GBV survivors can get justice as early as possible. Point number 3 talks about the partnerships relating to early reporting through collaboration. One of the biggest gaps that I can say are there when it comes to supporting survivors of GBV is the window of reporting. So if it's reported late, how many more people have suffered through the same channel or the same perpetrator? Yeah? How well can we assist you if the reporting is done late? But if you are working with people in the community, then it becomes so much easier for us to support people because they report on time, we get the data on time, and we get assistance on time. There's also capacity building, majorly for the NPS, that's the National Police Service, in improving documentation. So we've done a lot of capacity building for the police, because most of these cases will find themselves at the police's desk. And to be honest, this capacity building has led to a very high referral rate, a very high referral rate of, I believe, 76% in the last year coming from the police sector. So even as we look at different places we'll have to capacity build, we can see how this directly translates to referrals and also directly translates to support. As point number 5 says, elimination of barriers such as the kangaroo courts, and this is where the community tries to settle matters of GBV when they feel as if this is how we should do it, we should not take it through the legal way. And to be very honest, in such cases you find justice is not served. Yeah, GBV can happen and then the community says, you know what, to bring 10 cows. 10 cows is not worth the life of a young girl, it's not worth the life of any person. So in the same way, the strategic partnerships are allowing us to eliminate such barriers. Lastly, addressing harmful cultural beliefs and legal illiteracy, just like Mercy mentioned. So as we conclude, we've talked about what we are doing, we've talked about how we are doing it, but we also have to understand why is it important? Why is it so important that survivors of gender-based violence are receiving justice? So number 1, access to justice supports psychosocial rehabilitation. How does it do this? Number 1 is impunity. I've had cases when you go to the ground that there is a serial rapist in such and such a place. And you sit and wonder, as long as this person is there, these cases will continue to pile up. But if we can find a way to access justice, to be able to report the cases, to follow up on these cases and to get justice, then this impunity cannot continue. Other men who might be in the same line of abusers cannot continue with the same thing because they have an experience, they have a picture of this is what happens for people who abuse. And that's what we are trying to see. So dismantling that culture of impunity deters other offenders and also makes it safer for young girls, for boys, and also for women in the community. Number 2 is protection of children and adolescent survivors. For those of us who have interacted with individuals in the field or individuals who have experienced GBV, you understand how devastating it can be. So you can imagine for young girls, young boys, these are adolescents, we are trying as much as possible to protect them. And if we can secure them, then their future becomes very aspiring. So that's also a very important aspect of access to justice. Number 3 is autonomy, dignity, and agency. As an individual, if I am abused and I cannot assure that I won't be abused tomorrow, my dignity cannot be secured, my autonomy, my agency, I cannot make decisions that decide and empower myself. So in the same way, in access to justice, we're trying to make sure that we restore that autonomy, that a woman who's gone through all this chaos can come out and be a champion and support other women as well. So in that case, autonomy becomes a priority. And lastly, justice is a human right. No one is bigger than the other. Every single person has equal rights to the other. I believe that should have been the first point, because I mean, why are we defending the fact that justice is there for everyone? And I think with that, justice delayed is justice denied. I conclude my presentation. Thank you very much.
I want just to give a small short story about, we said we are talking about the young girl, and the young girl is called Amina. Amina was traveling. This side it's Kenya, where we have the soil, and the other side it's Somalia. So this is at the border. So what happened to Amina? Amina is a young 13-year-old, newly married. As she was coming from the other side from Somalia, she was raped alone by, it was a gang rape. That she was 13 years. Already she was married, but she left the husband behind in Somalia. Through the rape, she became pregnant for the rape, not for the husband. She's still here. This is the border. So there's no going the other side. There's no way of coming this side. If it's drought, the Kenyan part is drought. The other side of Somalia, it's green. So they normally go, they walk like that. So through the rape, she got pregnant, and the pregnant, there was no hospital around there. So what happened? She delivered at home. When she delivered, she got fistula, obstetric fistula. Remember, she's a survivor of FGM. Through that, gang rape is there. Through the gang rape, she delivered at home. Because of the unsafe again delivery, she got obstetric fistula. And through the fistula again, the child she got she delivered a child who had, because of the complications and all that, the child again formed hydrocephalus, Doctor will help me, and spinal bifida. I'm not a medical person, so if you see me pronouncing some words, that's already a disclaimer, yeah. So, the same lady now, remember she's 13 years, with an hydrocephalus child, divorced, because when the husband heard about she has a child, she's already divorced. Remember, she left Somalia, she hasn't reached, okay, this side is now the refugee camp, when you come from the other side of Somalia. So she hasn't reached again the refugee camp to seek for the asylum. So she doesn't have any document. Her status is, she's not refugee, or she's not Kenyan, and she's not refugee. So she's just somewhere here now. We got her here, this soil. You can imagine a 13-year-old went all those through, problems. And again now, today she's 17 years. We are waiting her to reach 18 years, because all those repair for the fistula, they failed. And she lost her kid after 2 months. Because again of no referral. There were no referral, she don't know where to go again with the kid. Now she's 17 years. We are waiting her to reach 18 years so that she can be done a procedure, actually a major procedure called urine diversion. That is the 13 year we are talking about, and that is the 14 year we are talking about, and that is now the 17 year who is at home. So you can imagine her age between 13 to 18, what will happen in between. And again, we don't know whether when she reaches 18 years, whether she will accept again the urine diversion. So she joined us when she was 14 years. You can imagine I'm talking about these women now. And that was brought about the climate change and the climate stress. So Northern Kenya continues to experience severe climate-related challenges such as prolonged drought, flood, water scarcity, and loss of pasture. As you can see the picture. Climate change has greatly affected access of health services, whatever we're talking about. If in climate change, if we get flood, we have no access to the health center. If we get drought, the girls are being sold out there. The child marriage is there. Forced marriage is there. Sometimes if they refuse, they will be taken forcefully because we don't have money. The camels already died. Everything died. The only important thing, the gold we have in the house are 9 girls, all under 15 years. They are all sold. Okay. Impact of women and girls. Women and girls in pastoralist community are among the most affected climate-related challenges, increasing poverty and food insecurity. This is what you see. They come, run here, and we give them some small things, not even a house. There's no house there. So you see. So we give them the milk and the biscuits, they go, they sleep outside. They wait for the other day, Red Cross to come, someone else to come, MSF to come. They're just seated there. Challenging facing nomadic communities. Nomadic and pastoralist community faced unique challenge due to the mobile lifestyle and harsh environment condition. Remember harsh condition again, the sun again is part of the climate change. So we are never safe. We have the climate change, we have the harsh weather, we have the flood. So we don't have even a single day that we can enjoy in northern Kenya. Health facilities are often from the grazing route. And again, remember, these camels, on top of them, we have children. We're only seeing the women, right? The children are up there. Each camel will be carrying like 5 kids under 5 years. Where is the immunization? 0 dose at that time. So, okay, we have those small babies. Whatever we wanted to feed our children, we are feeding these children, these other children. There are 5 of them, because their mother died. They have no mothers. So, whatever our kids are eating, the plankton that we are getting from UNICEF, we are feeding these small animals. Women and girls in pastoralist communities are among the most affected by climate-related challenge, increasing poverty and food insecurity, often lead to early marriage, teenage pregnancy, school dropout, and gender-based violence. Pregnant women face higher risk during migration because of the lack of antenatal care, poor nutrition, and limited emergency obstetric services. Climate stress also increased mental health challenge and social vulnerability among women and adolescents.
So I come from the Gender Violence Recovery Center of the Nairobi Women's Hospital. We turned 25 years on 5th of March. So since inception, we have supported over 68,000 survivors of gender-based violence in 8 GVRC centers. So 8 GVRC centers means 8 gender violence recovery centers. And today, because then I'm going to talk about electoral-related gender-based violence, we've provided support to over 180,000 more through the emergency response program. Now, I was showing you this is just to give you a feel. So we do many things, but I'll just also focus heavily on response. In providing this support, it cuts across, as you've heard from Mercy and from Fatuma and David, that it cuts across all ages. The youngest survivor of sexual violence we've had is a 3-day-old baby. Yes, 3 days, 1, 2, 3. Sexual violence. But the survivor of gender-based violence, the youngest has been an unborn baby, because we have mothers who are beaten and they lose the pregnancies, yeah? The oldest woman we've had of gender-based violence was a 105-year-old woman. The oldest man was 76-year-old. Now, when violence happens, and it happens throughout, so you can see throughout the 25 years, the number of cases that we've had, when there's instability, so for example, the electoral period or the shadow pandemic of COVID-19, the numbers are high. In around 2020, 2021, we had 4,067 survivors of gender-based violence, and out of these, 208 are teenage moms. So you see the connection of sexual reproductive health, that you're talking about, and all those things, because then when there's this instability, they cannot access services on time. There's a lot of insecurity, so they are vulnerable. Women and girls, men and boys are vulnerable to violence when there's drought and so forth. So I won't belabor that because my colleagues have spoken about it. So what's happening now? So we have emerging trends already. You can agree with me that you're already within the electoral cycle. Sindio, si wakati tu wa elections. Sindio tumekuwa na maandamano. and Mary, you'll know Kiswahili at this rate. So we've had mandamanos, protests, and when there's protest, then women, men and girls, boys have been harassed. Yes, you know, people, when there's mandamano, actually we've had survivors who've been raped. We've had ladies who've had their phones, hope all grown ups, their phones removed even from, you know, you're hiding them in your bra, but they're gotten out, you're stripped. So already that's happening. So then it's important to note that we have emerging trends like femicide, technologically facilitated gender-based violence, that's already happening. So the more we are having these emerging trends and nothing is being done about it, you can count the number of femicide cases that have come to conclusion. I only know about 2. I don't know about you. And the numbers are really heavy because just between 2022 and 2024, the technical working group that was appointed by the president, Rajiv as the vice chair, recorded 1,069 cases of femicide cases. And because of that lack of accountability, what's now happening? Our children are being stolen, kidnapped, and killed. You see, so already we're in that phase, and then we are now around the electoral period. When I talk about technologically facilitated gender-based violence, you all know when people are campaigning. So there's all this AI, there are all these photos that are created to put you down and all that. All that is electoral gender-based violence, and you're already in that situation. As you do the emergency response, there are a lot of intersectionalities around it. So the girls, for example, around COVID-19, for 9 months, sanitary towels were being given through the what is it called, through the schools, but schools were closed for 9 months, so children could not access pads or SRHR information, and that's why we had 208 girls who are pregnant, who normally would have about 17 before that year or 20 thereabouts. So that's the problem. So those intersectionalities with floods, with what, you know, with everything else. So we've had a couple of situations, the Mount Elgon dispute, and I want to show you how, as much as we think it's an electoral period, it spans over 2 years. So it's not something that you just say after elections or shortly after that seat. No. In Mount Elgon, we had to go back 3 years later to get women and girls into a camp in Eldoret for us to provide medical treatment and psychosocial support. We had ladies who, one of them, I remember when they were kicking the door, she was delivering, she had a prolapsed nephrotic uterus. Another one, and they had to go for surgery. And for them to even come to that camp, they had to lie, by the way. They said they were going for a women conference. So we had to go there with doctors, figure out how to refer them. Others were infected. They would not say it. They would not, they were alienated from their families. It was a really bad situation. So I'm trying to tell you that it's not just about the electoral violence, it spans over. Another thing that has happened is that you cannot say, oh, they will come to GVRC. No, there's violence. So how do they reach? So the services have to go to the survivors. Again, you can't go and pitch a camp and tent and say, okay, wale wote wamerepiwa, all those who are ready to come, no, won't come. So you have to provide like medical clinics. So the whole essence of programming changes. The Tana Delta skirmishes, all of them, I was personally there with a few of my colleagues. In Tana Delta, you have to go with the KDF. Remember, one day you're going, and then one of them is the one guarding you. First, you have to leave before 3 a.m. So you're going because you're going for GBV cases and all that. But when you're there, then there's a lady giving birth. Now you have to figure out how to midwife. Then you're here, you have to come back before 3 because it was so bad. I don't know if you remember, the KDFs were also killed around that time. So the one next to you is crying. I can always remember his name. And now he's not supposed to guard you. He's crying. And then he's crying because he's lost colleagues, he's gone through all this. So there's a lot of trauma around it. Let's get more. COVID-19, I've spoken about it. Elections 2007. So for us at GVRC, our cases surge around this electoral period. In 2007, you can see the number of cases we supported. And it was over 3,684. What happens also around this period, you get what we call late presentation. So clients will not come to you within 72 hours. They'll come if there's violence. So first, let's get to safety. Then what happens, you go, let's say, to a camp. So what happens is then, by the time they are settling in a camp, trying to negotiate for food, trying to negotiate and make sure they are safe. But that woman, that's when she remembers, or rather that's when she has time after everyone is okay to remember, I was raped. Of course they remember, but I hope you get what I'm saying. So they're already infected, they're already pregnant. It's now the manifestations after. And again, the tension before. Remember, femicide cases and GBV cases, 68% of the alleged perpetrators are known to the survivors. There's that tension. Intermarriages. The other day, the Zakab guy was just telling me how they were fighting with the wife, because she's from a certain community, and they were discussing politics and things like that. So there's a lot of also gender-based violence around that period. So what happens? We need to have the community engagements and discussions right away. So what has happened just within the Accelerate, with support from the Embassy of Denmark, you cannot start setting up the response systems at that point. They have to be set up before and make sure that you have functional referral systems. So we have a toll-free number, we have the GBV protection centers. I've talked about the 8, the other 16 that have been set up in county government hospitals using the GVRC model at a national level by the then CS Professor Kobia to replicate that model into the 16, so that then there's also access to the services. We are working with 22 shelters, 15 of them supported by the Embassy of Denmark in Kenya, and 7 actually referred to a partner by them. And what happens is that as we are having these service centers, we're also realizing gaps at a national level. So for example, standard operating procedures. For example, what are the case management protocols around humanitarian settings? What are the clinical guidance at a national level, so that it's not just about these centers, also then capacity building other service providers to make sure that they standardize services across. And then we have the refunctional referral digital hub, where then we also call the whole app, where you're able to report, you're able to have case management, and then at a national level, then there's coordination of the scene, so that then as GVRC coordinates the GBV response system, and that worked well around the 2007, around the COVID-19 period, then we're all bringing all our different energies, resources, we synergize and see then how can we respond. So for example, someone will come and say, I have ambulances, we can do the rescues. Someone else can say, so that's emergency response, and also creating a situation room.
Let's do this exercise together. So I'll say, give me an E, you repeat E. Give me an E, give me an N, give me a G, give me an A. What do you think is the last thing that's missing on there? No? No? So I said E, N, G, A. What's the last bit? Yeah? Yeah, so let's all start together. Give me an E, give me an N, give me a G, give me an A, give me a G, give me an E, give me an M, give me an E, give me N. Thank you. And then T. What does that spell? Engagement. I'd like us to do a collective effort on an advocacy brief. You're either in this room, you're either a person in power, or you're someone who is my age and you are accessing power. The question that you're supposed to answer is, in your paper, what would you do now that would ensure the things you saw, what would you do now so that I don't see them as well, so that I don't experience them as well. So if you feel like you are a person in power, and guys, power is even starts at home as a parent. You can answer in terms of family, because I'm assuming some people have families, so before you're a family person, you'll be a mother and then you come to the conference, right? You can answer in that direction. You'll be a father, you come to the conference. Or you can answer as a young person. Your question is, what does meaningful youth engagement look like for you? What am I telling Dr. Pahe to do? Am I telling her, one, most times I'll come tell her, oh hi, I like your work, can you be my mentor? And then it's always, I am asking and I'm asking and I'm asking. My point was, at the end of the day, collaboration needs to happen between both of us. If she's writing a research paper, I'm offering to go to the field with her. And if she's in such a room and she has like 3 panels, she's now inviting me to her room. So all of us have a paper? Yes, please write on that paper. The question is, as a person in power, what are you committing to do? Are you committing to offer more spaces? Are you committing, the question, Koko Chini. Yeah, Koko Chini. So as a person in power, what are you committing to do to young people? Are you committing to share spaces with them? Are you committing to educate them, to inform them, to show the places in those rooms? And as a person who is my age, what exactly are you asking from a person in power? Are you asking, I'm a sexual reproductive health rights person, I'd want to be in this conference? Or are you asking, I want to co-write a paper with you, I want to be funded for this? And then sometimes when we go to these rooms, we really have a very straight brief. Leo atakupata in finance, kesho they'll find you in health, the other day they'll find you here. So even when she's calling you, she doesn't know what exactly you're really asking from the table. And whatever you answer will be used for us to write a paper, for us to show next time. If you want to leave your email there, we will email you together with Yes Kenya, and we'll write, as young people say, this is how engagement looks like for them, and all the people committed to, that's what they do. So as you're writing that, I'll tell you principles of meaningful youth engagement. And there's actually a framework that exists from UNESCO that shows us that this is how meaningful youth engagement looks like. It's not inviting me to a room and then I sit, the panel is 5 people that are older than me, and then you look at me and you say, oh yeah, so we have a young person, you can say hi Joanne, and then Joanne goes home, and then I have to go to LinkedIn or wait for the panel to end, and then I take the photos, and all of you tell me congratulations, but I didn't speak. Or you invite me to the room, I will speak, but no action will be done on what I have said. Also the youth, let's all hold ourselves accountable. You'll be invited for public participation, you will not go. You do not even want to search where those things are. You do not want to know where those things exist or even where they are. And then, or you're invited to a conference, and then probably the whole day you'll be on this side and the conference is on that side. And then when you go home, you'll say, so Jennifer, you didn't even give me a room, because she saw you sleeping there and she said, next time I'll not invite you. Again, we also say we want PAHE and I to collaborate, but also we would want the government, institutions and schools to hold us. So if it's meaningful and it's intentional, it means PAHE, myself, someone from the government or someone from the same institution, all of us are coming together. So meaningful youth engagement practically looks like this. So I'll ask Dr. PAHE and I'll ask Halima, who was not knowing that I'll do this to her. So this is my last thing. So I'll ask Halima to stand and I'll show you a practical example of meaningful. See? Meaningful guys. So an example is Halima is my head at the department, graciously brought me here. So she was like, yeah, come go learn. And she's been asking me, have you been learning? So this is how it looks. I'm the young person. I'm aiming to be like these 2 women, and they are already here. So my work is to learn from them, or ask for permission, or ask them, can I really follow you? Do you want me to add like a full stop because I know you are tired? I can even add like a full stop. It will work. So this is how it looks like. PAHE and I will hold hands, and let's imagine this is a government entity, right? So this is us coming together. So this is meaningful youth engagement. Them holding my hand. Thank you so much, and we'll write that paper.